The prothrombin time test evaluate which pathways? Option A intrinsic, option B extrinsic, option C common, option D intrinsic plus common. The prothrombin time test evaluate which pathways? The correct answer is option B extrinsic and common. Prothrombin time measures the extrinsic and common pathways like factors 7, 10, 5 to fibrinogen. Prothrombin measures the extrinsic and common pathways like 7, 10, 5 to fibrinogen. The activated partial thromboplastin time test evaluate which pathways? Option A intrinsic, option B extrinsic, option C common, option D intrinsic plus common. The correct answer is option D intrinsic plus common. Activated partial thromboplastin time test intrinsic and common pathways factors 12, 11, 9, 8, 10, 5, 2 and 1 factor. Which factor deficiency affects both prothrombin time and activated partial thromboplastin time? Option A factor 7, option B factor 8, option C factor 10, option D factor 9. The correct answer is option C factor 10. Factor 10 is the common pathway, so its deficiency prolongs both prothrombin time as well as activated partial thromboplastin time. Factor 10 deficiency affects both prothrombin time as well as activated partial thromboplastin time. Which of the following prolongs thrombin time? Option A heparin, option B low fibrinogen, option C fibrinogen inhibitors, option D all of the above. The correct answer is option D all of the above. Thrombin time measures conversion of fibrinogen to fibrin, heparin, low fibrinogen or inhibitors of fibrinogen or fibrin formation all prolongs thrombin time. Heparin, low fibrinogen inhibitors prolongs. The patient has prolonged prothrombin time but normal activated partial thromboplastin time. Which factor deficiency is most likely? Option A factor 8, option B factor 9, option C factor 7, option D factor 11. The correct answer is option C factor 7. Factor 7 is a part of extrinsic pathway only, so prothrombin time prolongs while APTT remains normal. Activated partial thromboplastin normal. A patient has prolonged activated partial thromboplastin time but normal thrombin time. Which of these factor deficiency is likely? Option A factor 7, option B factor 8, option C factor 10, option D factor 5. The correct answer is option B factor 8. Correct answer is option B factor 8. Factor A is a intrinsic pathway. Its deficiency lead to prolonged activated partial thromboplastin time but thrombin time, which disorder is characterized by widespread activation of coagulation leading to consumption of clotting factors and bleeding. Option A hemophilia, option B von Willebrand disease, option C disseminated intravascular coagulation, option D thrombocytopenia. The correct answer is option C disseminated intravascular coagulation. In disseminated intravascular coagulation, both clotting and bleeding occurs linked to massive consumption of factors and platelets. Which of the following is not part of fibrinolysis? Option A plasmin, option B tissue plasminogen activator, option C urokinase, option D factor 13. The correct answer is option D factor 13. Fibrinolysis is breakdown of fibrin by plasmin activated by tissue plasminogen activator, urokinase, etc. Factor 13 stabilizes fibrin and is not part of fibrinolysis. What is the role of plasmin in blood? Option A converts fibrinogen to fibrin, option B cross-links fibrin, option C breakdown of fibrin clot, option D activates clotting factors. The correct answer is option C breakdown of fibrin clot. Plasmin is the main enzyme of fibrinolysis. cleaving fibrin to soluble degradation products. Plasmin is the main enzyme of fibrinolysis, cleaving fibrin to soluble degradation products. Tissue plasminogen activator acts by converting option A plasmin to plasminogen, option B plasminogen to plasmin, option C fibrinogen to fibrin, option D prothrombin to thrombin. The correct answer is option B plasminogen to plasmin. Tissue plasminogen activator converts plasminogen into plasmin, which then degrades fibrin. Tissue plasminogen activator, which of these is a function of antithrombin 3? Option A activate prothrombin, option B inhibit thrombin and factor 10A, option C activate factor 12, option D cross-link fibrin. The correct answer is option B inhibit thrombin and factor 10A. Antithrombin 3 is a natural anticoagulant that inhibits thrombin 2A and factor 10A, and to lesser extent others. Heparin potentiate the action of which anticoagulant protein? Option A protein C, option B protein S, option C antithrombin 3, option D plasmin. The correct answer is option C antithrombin 3. Heparin binds to antithrombin 3 and accelerates its inhibitory action on clotting proteases. Heparin binds to antithrombin 3 and accelerates its inhibitory action on clotting proteases. Warfarin works by inhibiting which process in clotting factor synthesis? Option A proteolytic cleavage, B phosphorylation, option C carboxylation of glutamic acid residues, option D glycosylation. The correct answer is option C gamma carboxylation of glutamic acid residues. Warfarin is a vitamin K antagonist and prevents gamma carboxylation of glutamate residues on factor 2, 7, 9, 10. Which of the following is an immediate reversal agent for warfarin? Option A vitamin K, option B protamine sulfate, option C fresh frozen plasma or prothrombin complex concentrate, option D aspirin. The correct answer is option C fresh frozen plasma or prothrombin complex concentrate. To reverse warfarin rapidly, administer plasma or prothrombin complex. Vitamin K works but more slowly. Which of the following is a direct thrombin inhibitor? Option A warfarin, option B heparin, option C dabigatran, option D aspirin. The correct answer is option C dabigatran. Dabigatran directly inhibits thrombin factor 28. Dabigatran is a direct thrombin inhibitor. Which of the following conditions is associated with activated protein C resistant, often due to a gene mutation? Option A hemophilia, option B factor 5 Leiden mutation, option C hemophilia B, option D von Willebrand disease. The correct answer is option B factor 5 Linden mutation. The factor 5 Linden mutation leads to resistance to cleavage by activated protein C, increasing thrombosis risk. Which of these is not inhibited by activated protein C? Option A factor 5A, option B factor 8A, option C factor 9A, option D factor 12A. The correct answer is option D factor 12A. Activated protein C degrades 5A and 8A requires protein S cofactor. It does not target 12A. Factor 12A is not inhibited by activated. In which of the following is a deficiency of von Willebrand factor? Option A, Hemophilia A. Option B, Hemophilia B. Option C, von Willebrand disease. Option D, DIC. The correct answer is option C, von Willebrand disease. Von Willebrand disease involves deficiency or dysfunction of von Willebrand factor. These two platelet adhesion issues and also reduces factor 8 of life. Which of the following laboratory finding is characteristic of von Willebrand disease? Option A, prolonged PT and normal APTT. Option B, normal PT and prolonged APTT. Option C, prolonged bleeding time reduced VWF, sometimes prolonged APTT. Option D, normal bleeding time, prolonged PT. The correct answer is option C, prolonged bleeding time, reduced Willebrand factor, sometimes prolonged activated partial thromboplastin time. It impairs platelet. What effect would severe liver disease have on coagulation? Option A, increased clotting. Option B, decreased production of clotting factors. Option C, no effect. Option D, only affects platelet count. The correct answer is option B, decreased production of clotting factors. Most clotting factors except VWF are synthesized in the liver. Liver disease impairs their production, causing bleeding tendency. Which factor deficiency is seen in parahemophilia? Option A, factor 5. Option B, factor 8. Option C, factor 9. Option D, factor 11. The correct answer is option A, factor 5. Parahemophilia, also called acquired factor 5 deficiency, affects factor 5 rate. Alternatively, hemophilia 5 is not a standard. Some sources confuse, but parahemophilia refers to factor 5. Which factor deficiency leads to afibrinogenemia? Which factor deficiency leads to afibrinogenemia? Option A, factor 1. Option B, factor 5. Option C, factor 10. Option D, factor 12. The correct answer is option A, factor 1. Factor 1 is fibrinogen. In fibrinogenemia, fibrinogen is absent or severely low. In fibrogenemia, fibrinogen is absent or severely low. Which factor is first to appear activated in the contact activation intrinsic pathway? Option A, factor 12, then 11, then 9, then 8, then 10. Option B, factor 7, then 10. Option C, factor 3, then 7. Option D, factor 5, then 2. The correct answer is option A. The contact activation pathway goes 7, 11, 9, 8, 10, 5, 2, 1. Which factor deficiency often shows no bleeding tendency despite prolongation of APTT? Activated partial thromboplastin time. Option A, factor 12 deficiency. Option B, factor 8 deficiency. Option C, factor 9 deficiency. Option D, factor 11 deficiency. The correct answer is option A, factor 12 deficiency. Deficiency of factor 12 prolongs activated partial thromboplastin time but does not typically cause bleeding symptoms. In which condition is there an acquired inhibitor against factor 8? Option A, hemophilia A. Option B, von Willebrand disease. Option C, acquired hemophilia. Option D, DIC. The correct answer is option C, acquired hemophilia. In acquired hemophilia, autoantibodies against factor 8 appear, causing bleeding in patient without genetic hemophilia. Which of the following is not measured by the PT test? Option A, factor 7. Option B, factor 5. Option C, factor 8. Option D, factor 10. The correct answer is option C, factor 8. Prothrombin time, extrinsic plus common pathway 7, 5, 10, 2 fibrinogen. Factor 8 is intrinsic and is not measured by prothrombin time. Prothrombin time test extensive plus common pathway 7, 5, 10 to fibrinogen. Factor 8 is intrinsic and is not measured by PT. Which clotting factor is lacking in the Christmas disease? Option A factor 7, 8. Option B factor 9. Option C factor 10. Option D factor 11. The correct answer is option B factor 9. Christmas disease is Haemophilia B due to factor 9 deficiency. Factor 9 clotting factor deficiency is called Christmas disease. Which of the following statement is true regarding factor 5 London mutation? It causes increased sensitivity to protein C. Option B. It causes resistance to activated protein C. Option C. It causes deficiency of factor 5. Option D. It causes increased breakdown of factor 5. The correct answer is option B. It causes resistance to activated protein C. Factor 5 Lendin is a point mutation that makes factor 5A resistant to inactivation by activated protein C. Which factor is also called plasma thromboplastin antecedent PTA? Option A factor 11, option B factor 9, option C factor 8, option D factor 12. The correct answer is option A factor 11. Factor 11 is sometimes refers to as a plasma thromboplastin antecedent. Factor 9 is sometimes referred to as plasma thromboplastin antecedent. Which factor is missing in the classical no factor 6 in coagulation nomenclature? Option A factor 6, option B factor 7, option C factor 5, option D factor 8. The correct answer is option A factor 6. Historically, there is no clotting factor 6. It was removed after nomenclature adjustments. Which factor is missing in the classical no factor 6 in coagulation nomenclature? The correct answer is option A 6. A person has bleeding postpartum and lab shows prolonged PT and APTT. Which deficiency might explain this? Option A factor 7, option B factor 8, option C factor 10, option D factor 5. The correct answer is option C factor 10 or D factor 5. The correct answer is option C as well as option D factor 10 and factor 5. Factor 10 or V deficiency common pathway would prolong both PT and APTT. Prothrombin time and activated partial thromboplastin time. Which factor activated by extrinsic kinase complex? Option A factor 9, option B factor 10, option C factor 11, option D factor 8. The correct answer is option B factor 10. The extrinsic kinase tissue factor plus factor 7A activates factor 10 to 10A. The extrinsic kinase tissue factor plus factor 7A activates factor 10-9A. Which factor is typically normal in von Willebrand disease? Option A BWF von Willebrand factor. Option B factor 8 levels. Option C factor 9 levels. Option D platelet count. The correct answer is option C factor 9 levels. Von Willebrand disease affects von Willebrand factor and secondarily 8, but factor 9 is unaffected. Which of these is the immediate substrate upon which factor 10A acts in presence of 5 calcium phospholipid to produce thrombin? Option A fibrinogen, option B factor 1, option C prothrombin, factor 2, option D factor 8, 13. The correct answer is option C prothrombin factor 2. The prothrombinase complex 10A plus 5A plus calcium plus phospholipid converts prothrombin 2 into thrombin. If a patient is taking warfarin, which clotting factor levels decreases first? That is shows earliest prolongation. Option A factor 2, option B factor 7, option C factor 9, option D factor 10. The correct answer is option B, factor 7. Factor 7 has the strongest half-life among vitamin K dependent factors. Thus, prothrombin time is prolonged early. Factor 7 clotting factor level decreases when patient is taking warfarin. Thank you all.